It's a pleasure to welcome you for this fourth module of the cluster management series. It's a training series that is provided by Clusters4Health. And today in this new model, we are very delighted to welcome Dr. Monse Daban. Monse, you have very extensive experience working in a cluster, especially with international relations. Including with EU projects. And today you will talk about cluster services and how to build a portfolio of services. And you will give us insights and learnings from the INNAXE project that you have been working on. So, Monse, thank you so much for joining us. The floor is yours.
Thank you very much, Marine, for this presentation, and I am happy to be here with you today. I will try to facilitate translation, but as I will be sharing some slides in English, I promise to translate everything to Ukrainian and send it to you all later, because there's a lot of text in this presentation. I apologize for the text, but I think that it is worth that we exchange some of those visions. And I will very much look forward to your questions at the end. I will try to share my screen if it's okay. I will share my screen and I will just go to, can you see that? Okay. Yeah.
Yes.
Okay. Thank you. So the project, you know the project already, Clusters4Health. It's about accelerating European Ukrainian clusters in this partnership in health with other clusters in the EU and also in Norway. So what I would like to say to you is that this building these cluster services, it's something that we've been learning from a couple of projects in INNAXE, and also I included BRIGHT. It's another interesting project that gave us a lot of information. And well, I am connected to the Council of European Bioregions, but also to the DG GROW as a member of Clusters Expert Group. I would like to share with you the objectives of the session. I think it's interesting if we can understand what makes a competitive health innovation ecosystem. I am not seeing anybody in this screen in this room, so at any point you please interrupt me and let's stop if because of the translation or because of the subject we discuss. I would like to translate INNAXE and BRIGHT project learnings into actionable services. And this is what I would like to explain you how to do that in the future. I also would like to identify which are, for example, some service models for clusters based on practices that are evidence-based as well. So we need KPIs to know what works better for the ecosystems, and also learn to work on the impact pathways. What is an impact pathway? A lot of EU projects require this impact pathway vision, and it's interesting to have it as well. I would like to provide a service design checklist for a cluster organization. It is also interesting. And I would also like to discuss how to build monitoring, benchmarking, and impact frameworks for that are feasible and useful for every single cluster that is together in this project and connected today. So is it okay so far? If not, of course, please tell me if something can be just explained a little bit more. I would like to talk about health challenges and what is a health innovation ecosystem, why ecosystems matter, why clusters or ecosystem organizations, what our project INNAXE reveals about ecosystem maturity, what the project BRIGHT Insights for skills and services are useful for us today. I would like to mention some 10 elements of successful ecosystems like BioCats and CBER's lessons learned, BioCat, my organization, and also the Council of European Bioregions, but it can be any other network lessons learned and any other clusters lessons learned. Um, Also talk about some core service pillars for clusters, and also it's a synthesis of INNAXE and BRIGHT. In INNAXE in particular, I would explain more about the project, but we analyzed what high-performing clusters do and also how pathway or logical frameworks, log frames, helped INNAXE to build, to design some cluster services. I am sure that there are partners from both projects today here with us. And at any point, please tell and connect. I also want to share how to build these competitive cluster services, some key learnings together. I would like to mention some emerging priorities, not 2025, we are already in 2026, some final takeaways and leave some space for discussions. It's a lot, so I will try to just focus on some things that are more interesting. But for me, it is very important to understand now in this moment, which are the health challenges for most of us, and in Ukraine, you have to add everything that has come with this terrible war. But there will be some key points for Ukraine in this roadmap for the future. But this is quite collective. In the next 10 years, biopharma or health innovation stakeholders, we need to solve some challenges collectively. So this is why we work together. And some are linked to the biopharma, to some aspects. We have some levers. It means how we can what can we use to solve this? And we need some KPIs. We need to understand where are we going, which is our safety signals for aging in all Europe. Of course, in this moment in Ukraine, demographically, you have very urgent and pressing matters, but mental and brain health is being and is going to be a main issue. So we have to treat that. Cancer, antimicrobial resistance is a very important challenge. Health equity gap across Europe and rare diseases. So on top of everything that is going on the pressing matters that you are suffering, there's these layers of shared challenges. So there's a lot of work that we have to do together. And this is why we work as ecosystems. And this is an image of our region. You can find this in our website. And this is the number of companies and institutions that we have in the region. Part of them are startups and scale-ups, but an ecosystem is a coordinated community of actors that are interdependent and generate all together, validate, adopt, and scale healthcare innovation. So this is what we do in ecosystems or clusters, and it can include any one of these types of ecosystem players: industry, hospitals, investors, payers, regulatory bodies. Government, of course, has to be there. Patients, citizens. We have to integrate more citizens, not just when they become patients. And the success can be measured by density, connectedness, talent, and ability to translate ideas into value. And value means different things for all of us, probably, but there's some core aspects of value. And in that case, in our case, in Catalonia, for example, as I am using this as an example to kind of design what is an innovation ecosystem, we connect the international sphere, as we are doing today, to our research and academia with the centers, universities, etc., entrepreneurship with startups, spin-offs, venture capital, companies and associations, because sometimes companies connected as clusters themselves, subclusters or associations of companies, pharma, biotech, medtech, it's important that they are also connected within the ecosystem. Also, society and policymakers at all levels, local, regional, country level, healthcare facilities, healthcare providers, healthcare professionals, and then all that has specific challenges that we, when we connect them together, make them transversal. Talent, funding, tech transfer, adoption, and scaling up are typical ecosystem challenges. And typically in our industry, we have the challenge to recover value chains because they have been disrupted by the war, by the COVID, still has some impact. And now we have to adapt to the new trends, digitalization and telemedicine, advanced therapies and personalized medicine, circular economy, and financial sustainability. It is not possible to live with the same system that we have now, with the resources that we have and the cost of the new treatments. So it's a lot to work on that level for our industry. And additionally, from Europe, and now that everybody talks, and these days have been talking about the single market more and more, and you are going to join from Ukraine to the single market, the twin transition, digital and sustainable, the tech independency, so not depending on other regions in the world for our technologies, having social impact, positive for social impact for all of our actions, making health systems more resilient and our societies more resilient, and funding deep tech talent is what our health innovation ecosystem has to look like in the next years. So programs for that, services for that is what we have to deliver. An ecosystem, and this is in Catalan. I didn't have the image in English and I didn't translate, but it's very easy to read. An ecosystem is something that when a disruption emerges, it is usually well structured with science, human capital, politics, or policymakers, investors. But when something happens, like the war, like the COVID, like some disruption, every single thing that is emerging in terms of innovation is disrupted. And then there's an abrupt increase of innovation. The ecosystem kind of realigns, and what comes from that is different, is reconfigured, has a different shape. And this is what the opportunity that, despite all the pain that the war has caused, the opportunity for the future is another system reconfigured with another shape in which shared agendas have to align efforts. And this is what we have to do with the clusters in Ukraine and in Europe. But ecosystems matter because it's important that faster translation of research into innovations, better scaling of companies and technologies, increased investment, etc., etc. This is what ecosystems do, and this is why ecosystems or clusters matter. This is an example of our connection of ecosystems and clusters in the Council of European Bioregions. It's an example on a network, and you have more. I mean, the coordinator of this project, Imago Mol, is also coordinator or chairs Medignest, which is a similar network as this one. Working in networks makes us stronger, and we can represent a lot of stakeholders with their needs and their capacities. This, I like it very much for an innovation ecosystem life cycle. You can start being a stand-up with early and late configuration for an ecosystem, a stand-up at the beginning, or a startup ecosystem. And this represents different regions in the world that have this kind of early or late startup. Also scale up when you are a little bit more in advance, you're growing. In this case, Barcelona, for example, is here. And we are coordinators of one regional innovation valley that, adding all the regions together, places itself here in number of scale-ups. So that is the value of collaboration. But if we add all regional innovation valleys, we end up with one single European scale-up ecosystem that is larger than Los Angeles, for example. So this is the value of us working together and the value of understanding the services and the cluster dynamics. In BioCat, for example, we have been working for 20 years. This weekend, we had our 20th anniversary with different stages. But now we are working in more Europe, leading networks, and this is the landscape of our EU projects. So now we are working with you here in Clusters for Health with more focused projects on solving all these kind of challenges. But Bright and INNAXE actually are here in this period. So what we learned in INNAXE. So we did a benchmarking across 85 clusters in 25 countries, and we saw that these clusters belong to leader, strong, moderate, or emerging innovators regarding the Regional Innovation Scoreboard. And what we saw here is that the maturity, the number of organizations in the ecosystems depends on the type of innovation maturity in the different clusters. For example, leaders have 2.5 to 5 times more organizations in the ecosystem. Remember at the beginning, we talked about density. It is very important that we are able to share not just an area, a space, but also strategy and increase the number of associations of companies, public-private partnerships. The partnerships within the ecosystem are very important. Those are what we learned from INNAXE in terms of some KPIs. Also important having education programs, talent pipelines, and tech transfer activity that is strongly correlated with maturity. The more mature an ecosystem or a cluster, more talent pipelines you can find together, more tech transfer activity. The leaders rely on a customer relationship management system. In expert groups, they talk to their experts to understand the challenges. In a lot of meetings within and broad surveys within the ecosystem. So talk all the day long, all the week, all the year long with the members of your cluster. And moderate regions depend more on public funding and collaboration among the tech transfer offices. So the more advanced, the more mature an ecosystem, less public funding is necessary. But this is normal because you're attracting more pharma companies, more large companies. So it is also a goal, being capable of attracting some activity. Most clusters lack resources for systematic ecosystem monitoring. That is a very important aspect, monitoring the ecosystem. And you need to have in place some kind of business intelligence, people that understands KPIs and help track the advancements, how is the improvement of the ecosystem. And across Europe, we found in INNAXE, as this is an INNAXE outcome I'm sharing with you, the more mature an ecosystem, the more the digitalization challenge is addressed. I have here the logos of the members of this project, INNAXE. But it is not very clear because I had to enlarge the picture. But this is, like I said, the average of public funding, and it changes according the leaders or the emerging. So the emerging have a little bit more, or the moderate more public funding needs that probably the leader. I am going to explain now something that has to do with our work at INNAXE. When we talk about, this is quite complicated, let me just explain a little. When we talk about logical framework, we talk about this process of activities that require inputs, and inputs are resources, people, infrastructures, everything that you put in your activity and the activity you do with this. And that generates primary results. Let's, for example, number of people that participate in this meeting today, or the number of like the training, or the active actors in our network, or the number of people answering a survey. This is an output, but this is not an impact. The outcome is a next level of results in which these initial results generate something else. For example, if this meeting today generates new collaborations, that could be an outcome of today's meeting. But that is not impact. Impact is if this collaboration altogether in the next 2, 3, 5 years generates some result in the market, or some investment, actual investment in one company, or etc. So that is the impact. And what we did in INNAXE, we tried to identify the 5 areas or 6 in which we thought that it was important to have as health ecosystems an impact. And I'm going to share this here. So we decided that our areas, and this is a deliverable that I will be happy to share with you, but at the end, we have these logical frameworks. And the aspects that we thought that were important is that market, we need in our work to increase the market size. We need to have more companies. What we want to have in 5-year time is an increase in life science and healthcare contribution to GDP. And we need indicators, and the indicators in impact are always a percentage of increase or decrease. And we want to increase the GDP deriving from life sciences and healthcare over time. And we want to increase the number of regional companies that shared market access over time. So the outcomes for that, we place ourselves a little bit earlier, and we identify what could be a middle step, would be number of regional companies that act internationally, or companies established in the region, or companies increasing sales. And these are the outcomes we need to measure, and we have to identify which KPIs we want to use. But before that, we need outputs. We need to organize business missions. We need to organize training. We need to provide soft landing services. How do we measure the output? With a set of indicators that we can think all together. But for that, we need to have some activities. And the activities is we have to organize business trade and missions. We need to have training in place on market access, etc., etc., etc. That for market. But if we go to talent, we have the same design. We need that regional life science companies and academic institutes are able to fill all positions with trained personnel. How? And we place ourselves a little before and a little before, and then we know what we have to do. If what we are doing now does not link directly to the impact that we want to have in 5 years, we have to change the activity. And there you have the services and the activities that a cluster has to provide. But first you must know where you want to go. The same for innovation and transfer. The same for funding. We want sufficient funding for academia and industry to reach their goals with indicators. And the same for policies, increased prioritization of life sciences and healthcare on political agenda. And the same for healthcare provision. We want efficient healthcare provision improved through research and innovation. This is the logical framework we used in INNAXE. So I'm going to share again But SWOT, PESTEL, this log frame, anything, ESCA indicators, a lot of different. There's a lot of different in the market, or in the, let's say, as methodologies that can be used for that. We just have to find the one that is better for us. But I'm going to share again. So for example, in Bright, we did these insights, skills and services. We benchmarked this again, and then we found that we had some strengths. This is altogether the partnership. Altogether, we had as a strengths of our, we can do this as strengths of Clusters4Health as a network. In that project in Bright, we saw that we have collective expertise, different resources, more on digital resources, training, funding and investment programs for our companies. Cultural diversity is a strength, different activities. But we have weaknesses. Our coordination was very complex because of this diversity. The financial scheme of the project was not enough, and Alina knows well because it's a sister project. So there are weaknesses in us as partners, but we had opportunities. We had some synergies in the innovation agenda, as we also have. So there's, again, knowing very well your threats, your opportunities. And you said that, Marine, political and policy landscapes are a threat that we have to convert into an opportunity. The EU agenda on digital transformation can be an opportunity for an uncertain landscape, for example, because you are more capable of facing the challenges that you have for AI, race, or etc. So this, knowing very well. And but the competitiveness depends on how easy we can align our stakeholders. In one of your clusters, you have several companies, hospitals, players. If you can align these challenges and needs and interests of these stakeholders, you are more capable of succeeding. Also having programs for tech transfer, or supporting the tech transfer and entrepreneurship, making more startups to emerge and developing the talent. These are examples on how to support these skills and services that you need to provide. When we were doing this exercise, we built a portfolio of new processes, or of new services for the whole partnership, right? So we looked at which programs we had. For example, in the Ukrainian clusters now working all together, you can probably look at which programs you have, each of you, and try to build a consolidated program portfolio. A lot of times we have to look at ways to moving from the capacities you get in one cluster to the capacities you get in another when you collaborate. Imagine that you have 3 clusters that have complementary programs. That is very interesting because you can also provide mobility. So this is already a network in action. And at the same time, you don't need to do everything, because if your neighbor is doing this, your stakeholder is going to win from that. So you have to analyze the cluster capacities and draw a joint strategy with other partners. And we are doing this as well today. Sorry. And you have to design new services that are not in place. Not anyone has this service. Now we need to do this. And we probably start with a pilot and working with some close partners, stakeholders that can run this pilot, be in this pilot, testing this pilot to see if this is something that you need. And this is an example, right? I'm going to stop here. This is like one part of the story. So how to analyze and how to provide these new services. I am going to give you here, it's a lot of text. I promise I'm going to translate that into Ukrainian. But this is after 20 years of working in BioCat. We know a few things. One is that you need a systemic view. It is not enough to understand one part of the story. You need to make an additional effort to include those members that might not be very much engaged. And I'm thinking in one of your clusters, society now is under a lot of it's a lot of pain. It's an enduring complicated situation. But you have to talk to the society to understand what they expect from innovation in health. This is an example. So systemic view. Second is someone has to lead this collaboration. You probably are the ones that are going to lead. Is a collaborative leadership, and vision from every territory is different. And there are a lot of policies that are important to the regional authorities. You have to go closer to these policies and say, okay, you have a problem. I'm providing a solution. I'm leading this. And this is we are encouraging our clusters to do this, but we need to evolve. And Marine, this is something that you kind of touched, is the term ecosystem is evolving. In 20 years, it was before something that is not now, and we have to evolve with it. And innovation is also evolving because challenges are different. So your vision is that it has to solve challenges, but the challenges are more and more involving all society. And your role is connecting everybody, and also checking what is happening, how it is advancing, how assets are increasing, how objectives are achieved, and then balancing between complementaries and collaboration. It is very important, the substitution index. In an ecosystem, as things are not always the same, companies are created and disappear, or are sold, are licensed, or die. And a substitution is necessary. So always have a lot of partners participating in your pilots, for example. A little bit more, be fluid, every region have their values, and also how to contribute to solve big challenges, but also very important. And for us in Clusters4Health is very important. We have to convince our stakeholders of the importance of what we do together, and also convince Europe, the European Commission, of the importance of what we do together. And this we did in our meeting with the Commission. I think that was clear. This is a very good project for that. And I have to say that because it's very well coordinated and very, very important for Europe. And we need to drive authorities out of their comfort zone. But this is some summary of understandings for years. So some core services that we get from INNAXE and BRIGHT. Map ecosystem. Follow the talent that you have, understand what is there, and also benchmark, and also report periodically the advancements, because this way you become an authorized voice. So some programs, it's more internal, it's for the cluster organization, but understanding the figures. But also as a services, it's very important to have acceleration and tech transfer, some training for entrepreneurs, some investor matchmaking, understanding how to proof of concept, some clinical developments, clinical trials, supporting or connecting hospitals with innovators. This is like a very active always movement. Support the adoption of innovation, be aware of the needs of the system in terms of innovation to support innovators to provide the solutions. In your case, in the case that now we have in Ukraine, you have unfortunately a very specific situation that requires other and we had this beautiful clusters for health breakfast about procurement with these two big speakers explaining how the procurement is done in every case. Internationalization, business missions, we are always working all together, visiting each other, so it's very good. talent programs, and also have some space to influence the policy with working groups or white papers or explaining what happens there to require the Commission to provide the instruments for that. This is an example, again, of INNAXE, some aspects of the innovator profile and what they check, the political initiatives, the funds granted, all these ecosystems try to get this information. What high-performing clusters do differently is that they provide more professionalized services, this kind of customer relationship management systems, etc. Advice to the ecosystem, investment services. They run education programs. They use intelligence rather than broad surveys. They go to identify challenges, prioritize internationalization, have larger teams, 8 versus 2 in more moderate regions. They actively influence policymaking, and they implement a structured monitoring and impact evaluation tools like the log frames I explained. And the log frame that I mentioned helps us identify which programs we need to accelerate, which events are important, which partnerships can be formed, etc. And if we apply this, we can be seen as more trustable because our decisions are based on evidence, and it helps us prioritize the services that our clusters need and makes us a strategic actor, not just an operator that connects, but something that follows a strategy. And some high impact activities, according to the evaluation that we got from INNAXE, is that all regions, we interviewed our stakeholders, and what they valued the most were international event support. They appreciate the clusters supporting these companies and hospitals and institutions reach international partners, or also soft landing services. If we can help them find a place in the region or some supporting fiscality or other kind of services that are good for them. They appreciate the investor matchmaking. For example, we have a port. It's quite easy. You can put a B2Match portal in place in which you have the TTOs and the innovators enter their capacities or their projects or their businesses, and then you go to the partnering events and show this to investors, and they can also enter this B2Match and they can just meet each other. That's very easy to do, and it can provide investor capacities or investment capacities, promote entrepreneurship, meetings with policymakers. These had high impact across all regions. They all valued that. In moderate regions in particular, they want to have access to non-dilutive funding or funding from grants, for example, access to grants, to projects, to collaboration. And we decided that in Clusters4Health, this is also important. And they want some capacity building for TTOs, professionalized services, or some professionalization of TTOs managers. And this is very important because TTOs are a key factor for innovation, but not always have all the resources to support from academia to the market. And then in strong and leader regions, they have demand-driven initiatives. For example, if there's an increase in AI, for example, applications or advanced therapies or the personalized medicine, more and more initiatives that are leading in those paths. Also secondment of talent to TTOs, so from academia or companies going to TTOs, and some large strategic alliances. And this is what the different type of regions value, their stakeholders value more. But I think it's important that across all regions, internationalization, investment, entrepreneurship promotion are services that are in place. And then how to build this competitive. I would say that it's important that you can check a list of, if you have a strategic layer, which is your clear strategy aligned with, in INNAXE, it was a smart specialization strategy. but it can be any strategy that your region has. How clear your strategy is aligned with your region or your country strategy? Is there a strategy in Ukraine linked to the Commission to support one specific area or for the single market? Then just align your strategy to make your stakeholders to be more ready for the single market. Then EU missions, for example. You have to define these indicators very early where you want to arrive and involve all ecosystem players in the governance. It's important that a governance designs mimics the reality. Then there's an operational layer. It's important to have the knowledge of the ecosystem with this customer relationship management tool. In our case, it's Salesforce, but it's can be like a database, and have it structured in terms of what kind of companies, associations, who do we have here? Some modular service portfolios. So depending on now, you need more investment, you need more innovation support, and then always have feedback from the members, have like very well in place feedback channels. And then at the ecosystem layer, you need to provide collaboration. So some brokering events, some brokerage events. So you are the broker for these collaborations among the ecosystem players. So you have to put in contact everybody, even if it's 20, it's 200, doesn't matter. You have to have events or activities that connect them. It's important to see if there's a possibility to validate the data, clinical data, in some test beds to make sure that the advancements make sense and can be adopted at the end, and also have some international partnerships and this twinning and tripling activities to work with other regions and exchange good practices. And then a sustainability layer, it's always important to see which is your model. It's public, you have fees, or you rely on projects. And then also have to develop the capacities in your staff. Some learnings that we got from both projects is that size does not matter, it's the density. It doesn't matter if it's 20 or 200, but it's important that there's a lot of connections in between. That success requires integrating research, industry, healthcare, and policy. The talent and skills are non-negotiable. We need that in the cluster and in the ecosystem. So in our organization and among our stakeholders, adoption is something that we want to happen. So it has to be part of our long-term strategy. The monitoring, it shouldn't be a burden. You shouldn't need to be counting every day. It has to be light but continuous. Collaboration among clusters, we are doing this, accelerates maturity at all levels. And we have to position in Europe and be recognized in Europe as the interlocutor for our region. And some priorities I mentioned for Ukraine for 2030. And please tell me if you agree here and how we can transform that into the impact framework. Rebuilding and modernizing the health infrastructure should be a long-term goal. So we have to kind of divide it into how to do that, accelerating the transformation, strengthening health data governance, secondary use, because if at the end of the day, this is going to happen in all the European Union, plus in Norway that has adhered to the European health data space, reinforcing talent and specialized skills pipelines. We have to increase the capacity to produce this innovation, this value innovation, expand manufacturing capacities. You have in Ukraine, you have a long tradition and a lot of capacities. They might need to be rebuilt, but has to be boosted and expanded, supporting mental health and rehabilitation innovation. It's important that in your case, that is going to be probably number one or number two, so very important. Integrating Ukrainian regions into EU innovation ecosystems, we are doing this. Strengthening policy frameworks and regulatory capacity. The regulatory capacity now is a little bit similar, so now it has to be aligned more. Securing investment for reconstruction, supporting SMEs and startups in the health and biotech, enhancing resilience against future crises, because we have to be prepared, and positioning Ukraine as an emerging innovation hub. That is a ultimate goal, long-term goal, not just, I mean, for the society, but also for the Europe. And these are final takeaways. So a competitive ecosystem requires strong cluster services, and we saw some examples here. Our evidence shows what works and why, and Bright provides the skills and capacity model, so we can combine both things. We have to focus on density, connectivity, adoption, and internationalization. We have to build monitoring into your DNA. So and I like, because Alina always talks about Imago Mall DNA. I think it's a lot about that, and position your cluster as a strategic orchestrator. And now I have some proposals for questions. Which services are the highest priority for your region to think? What capabilities need strengthening in your cluster team? What joint programs could we build across ecosystems?